Hello everyone. This session will cover pharmacology of alcohol. Alcohol is mainly synthesized with the fermentation of sugars with the help of enzyme called as zymase. Alcohol has predominantly depressant effects on the brain. Hence it's a CNS depressant, like other drugs like general anesthetics, opioids, benzodiazepines, barbiturates. It mainly works by stimulating or mediating the effect of neurotransmitter, that is GABA, and thereby it stimulates GABA A receptor and increases its neurotransmission. And another mechanism is it also blocks excitatory neurotransmitter, that is glutamate. So it's known to block NMDA receptors. Hence alcohol is a GABA stimulator and blocker of NMDA. There are certain interesting and important points you need to know about pharmacokinetics regarding alcohol. First is it is absorbed rapidly from the GIT, and presence of food can delay its absorption. Volume of distribution of alcohol is it distributes in total body water because it is small particle and it is water soluble. Hence it is distributed in total body water, which accounts for 42 liters for 70 kg adults. Alcohol can cross blood-brain barrier, and that's why hence the CNS effects, whereas it can also cross placenta and can cause teratogenic effects in the fetus. 90% of alcohol is metabolized in the liver. Remainder could be excreted in lungs and urine. Another interesting point is alcohol follows zero-order kinetics, or we can say mixed-order kinetics. That is, at low dose, it follows first order, but as the dose goes higher or plasma concentration increases, it goes into zero-order kinetics because all the elimination points are saturated. There are mainly two pathways by which alcohol gets metabolized. One is alcohol dehydrogenase pathway and another is microsomal ethanol oxidizing system. Alcohol dehydrogenase pathway is the major one. In this pathway, ethanol is converted into acetaldehyde with the help of enzyme alcohol dehydrogenase. This is the first enzyme. Next, acetaldehyde is converted into acetic acid with the help of another enzyme called as aldehyde dehydrogenase. There is a drug which can inhibit aldehyde dehydrogenase known as Disulfiram. Disulfiram is known to inhibit this enzyme, thereby increasing the levels of acetaldehyde. And once the acetaldehyde level increases, that can lead to flushing, throbbing headache, nausea, vomiting, sweating, palpitations, dyspnea, hypotension, syncope, marked uneasiness, blurred vision, and confusion. So these are the unpleasant side effects which patient has to go through if patient takes accidentally disulfiram or disulfiram-like agents along with alcohol. Hence, disulfiram is mainly used in de-addiction of alcohol as an alcohol aversion technique. But in this, a patient has to be completely committed to leave alcohol. So let's discuss the drugs which have or which behave like disulfiram. So the drugs which behaves like disulfiram and the reaction caused by them is called as disulfiram-like reaction. This is the list of drugs. The first group would be metronidazole and tinidazole, which is an antiprotozoal drug. Second would be chlorpropamide, which is an antidiabetic agent. Then griseofulvin, which is an antifungal agent used in the dermatophyte infections. Then comes the last group, which is cephalosporins, which is an antibacterial. In the cephalosporins, these three particular drugs are associated with disulfiram-like reaction. The drugs are cefoperazone, cefamandole, and cefotitan. Excess alcohol intake can also lead to intoxication, and the symptoms of alcohol intoxications are patients will go through hypotension, gastritis, hypoglycemia, collapse, respiratory depression, coma, and death. So predominantly the treatment of alcohol intoxication is supportive measures, which constitutes gastric lavage, maintenance of patent airways, prevention of aspiration of vomitus, maintenance of fluid and electrolytes, treatment of hypoglycemia with IV glucose. This could be a very important ones because the patients who are on acute alcohol intoxication tend to go into hypoglycemia, and that's why IV glucose stays a very important treatment. And another supportive treatment would be vitamins like parenteral thiamine. Alcohol is known to cause both physical as well as psychological dependence. Hence, in chronic alcoholics who leave alcohol abruptly can go into withdrawal syndrome. Withdrawal syndrome can be moderate, mild, or it could be severe, known as delirium tremens. The overall management of withdrawal syndrome would be benzodiazepines. The long-acting benzodiazepines are usually preferred, so drugs like chlordiazepoxide, diazepam remains the drug of choice. Alternatively, you can give even lorazepam, especially in acute severe withdrawals. Other drugs are clonidine and propranolol, which can decrease the intensity of withdrawal syndrome, basically by subsiding sympathetic effects. Once the withdrawal phase is over, then benzodiazepines can be withdrawn gradually or with tapering doses, but it should not be stopped abruptly. Here are certain de-addiction techniques, that is psychological and pharmacological management of alcohol dependence. The first one would be aversion technique. Here, patient have to be committed to leave alcohol. In them, they are put on disulfiram. So whenever they are exposed to certain amount of alcohol, they go into disulfiram-like reaction. Another drug would be naltrexone, which is given 50 mg once a day, or topiramate, which is an anti-epileptic agent, or clonidine, which is alpha-2 agonist, can also be used. Acamprosate is another drug which can act as a substitution therapy because it is known to decrease craving for alcohol, and mechanism is similar to alcohol, that is, it decreases the NMDA receptor or blocks the NMDA receptor and increases the GABA transmission. The important indications of alcohol would be it can be used as an antiseptic, it can be used as a rubefacient and counter-irritants for certain sprains, joint pains. It can be used as an astringent, and it can be used in intractable neuralgias where in painful conditions like trigeminal neuralgia, alcohol can be injected in and around the nerves, which can cause complete loss of pain sensation. Another condition where alcohol can be used is methanol poisoning. So I would like to discuss the mechanism of alcohol use in methanol poisoning later. Two very important poisoning which you need to know is, one is methanol and second is ethylene glycol. Methanol is primarily used as it's also called as wood alcohol, which is used in country liquors as a form of methanol, and it can be adulterated with ethanol. And whereas ethylene glycol is commonly used as antifreeze agent, and there could be accidental poisoning with ethylene glycol. Now, the metabolism of methanol and ethylene glycol forms the same course as ethanol. For example, methanol converts to formaldehyde with the help of alcohol dehydrogenase, and then converted finally to formic acid with the help of aldehyde dehydrogenase. And formic acid is toxic to the optic nerve and can cause permanent blindness. Another drug would be ethylene glycol, which with the help of alcohol dehydrogenase converts into glycoldehyde, and then with the help of aldehyde dehydrogenase converts into glycolic acid and then to oxalic acid. Accumulation of oxalic acid is nephrotoxic. It can damage kidney and as well as it can cause CNS depression. In this case of poisoning, ethanol can be used because ethanol can competitively inhibit methanol metabolism. You know that alcohol dehydrogenase will metabolize both ethanol and methanol. Hence, ethanol will compete with methanol for alcohol dehydrogenase. And hence, conversion of methanol to formaldehyde and then to formic acid will be reduced. The same theory applies to ethylene glycol poisoning. Fomepizole is another drug which is alcohol dehydrogenase inhibitor, and this is also an antidote for methanol and ethylene glycol poisoning. Basically, it will inhibit alcohol dehydrogenase and will not allow them to convert into toxic metabolites. The teratogenic effects caused by alcohol on the fetus when consumed by pregnant mother is called as fetal alcohol syndrome, and the fetal alcohol syndrome is characterized by intrauterine growth restriction, microcephaly, marked CNS depression, and as well as mental retardation. Here are certain important drug interactions you need to know. There could be increased risk of hepatotoxicity due to acetaminophen or paracetamol. This happens especially in chronic alcoholics, because in chronic alcoholics, alcohol is known to induce liver enzymes, and because of induction of liver enzymes, certain higher dose of acetaminophen can cause accumulation of toxic metabolites called as NAPQ. And this NAPQ, which is a toxic metabolite, can cause hepatotoxicity. Another important interaction is it could act synergistic with other CNS depressants. So hence, the combination should be avoided. For example, alcohol in combination with general anesthetics, opioids, benzodiazepines, barbiturates can further cause CNS depression. And it can also enhance hypoglycemic effects of insulin as well as sulfonylureas. Hence, that should be avoided. And acute alcohol intake can also inhibit enzymes, while those who are chronic intake or chronic alcohol intoxication or intake would lead to metabolism of several drugs like oral coagulants, for example warfarin, sulfonylureas, and anti-epileptic drugs. So more or less they enhance the metabolism of substrates which are metabolized by CYP in the liver. This finishes session on alcohol, and keep listening to me. My more lecture videos are going to come in CNS, and please subscribe my videos. Thank you.